All right, so moving on, we're going to give Travis 10 minutes to give us all the answers around the new CMS rule. And by the time we leave here today, we will have everything in place for your November 17th, 2017 deadline. Okay, maybe I've exaggerated a little bit, but we'll see where Travis can take it.
There we go. So I was gone this summer, and again, my name is Travis Nichols, and I work with the Regional Healthcare Coalition. I was gone this summer, and when I came back, an early Christmas present was on my desk called Centers for Medicare, Medicaid, Emergency Management Conditions of Participation Rule. And just a quick show of hands, how many people in this audience are working with this topic right now? Awesome. And I really appreciate that, because as we get into this, it's something that affects all of us. And for me, it's a Christmas present, especially for anybody involved in the Healthcare Coalition, because it really does provide a pathway for all of us to continue to collaborate and build shared resources for shared outcomes with the guidance that's been given to us by CMS. So many of you know this was started in many ways back in 2005 as an outcome from Hurricane Katrina. There was 215 people that lost their lives in healthcare facilities during this event, something that CMS found unacceptable for good reason. And it's gone a long way. The Healthcare Coalition in our area, as well as Region 1 in North Idaho and other places, is also an outcome of this event and the lessons learned from it. So I think in many ways we can see this application of CMS's rules, a evolution of that work and a continuation of what's been on display for many people. But for many people, this is a new scope of work, because although how many people in this room are Joint Commission working with current accreditation requirements? Anybody else have accreditation requirements that are similar to what we've seen from the CMS rule? Not yet. So for a lot of people, this is a new field of work with new emergency management requirements to go into it. It was adopted in September 15th this year and published in the Federal Registry, and then in November 15th it became active. In March, we'll see an official guidance document come out on how this will be reviewed and implemented from CMS to state level. And then finally, we have about a year from today to wrap up compliance with this new COP. So a condition of participation is one of many, many rules. I think there's some 600 rules within CMS, and this is one new field that they'll be focused on. But the breadth of reach with this is the biggest change. Historically, our coalition and many other coalitions is focused on healthcare providers in the hospital setting, blood centers, dialysis, public health, emergency management, EMS. But as you can see, the number of organizations that are working with this has grown far beyond just people in this room. So I'm looking at the faces in here, and the diversity is ideal for work. All of you know this, but the rule is broken up into 4 primary elements. There's our emergency management program, of course, the assessment and planning component, the policies and procedures that support and respond to that, the communications plan, and the testing and training application. I wanted to just highlight a couple things that our coalition has been working on over the past couple of years that probably fall in or are pertinent to your agency's plans at working in this organization. It's worth noting when we start, though, that it's really clear to us as a coalition, and I think other coalitions around the country, that we're not here to do this work for any organization. Every organization is needing to meet their own CMS requirements, and we've got a couple tools that can help with that. And one of the outcomes that we'd like to hear from today are what are the other tools that we'd like to hear, that you'd like to see us work on or develop that could assist you in your moving forward with CMS. So one quick note is in Region 9, our last hazard and vulnerability assessment. Every one of these plans at a facility level is required to do, as part of your assessment and planning piece, a local hazard vulnerability assessment as well as an individual facility plan assessment. But at a regional level, know that our last hazard vulnerability assessment was in 2011. That's still our current plan, and there's no immediate plans to update that for emergency management part. Easy access. It's available on our Healthcare Coalition website right now. You can download it. Ed, is that mic working? This one might need a recharge. Okay, we're good. The next point I wanted to make was we have a continuity of operations guide that was developed by the coalition and shared out back in 2012, I believe, 13. It's a really great document, also available on our website, that can walk through some really standard questions about how your facility might address your planning when it comes to working with those vulnerabilities you develop as part of your assessment and planning process for this rule. Our next one I wanted to highlight was a situational awareness assessment, our EEI program, basically getting a good idea of what is happening during an incident and understanding what the implications are to the macro level. So getting information from each facility about what's operational, what's not, and then being able to push that back out so you can make good decisions about your organization's plans and appropriate responses as it pertains to healthcare. Something we've been working on with a committee that we call the Healthcare System Operational Response Committee that Ryan Traylor and Ed led over the past year and concluded this summer, I believe. And there's a bunch of great plans that are in place to continue to develop and implement that information sharing process during disaster. So something you might want to incorporate into your communications plan. Our agency contacts list is something that we maintain at a coalition level. It hasn't been published for a while on our website, but something we're planning on putting out in the next couple of months to make sure we have good, accurate information available for all of you. Redundant communications are an expectation under the CMS rule, and this is a place to get good facility contact information and share it out with partners. Our WATRAC system is also something you might want to note in your communications planning. It's a Fed tracking tool. It has the ability to send and receive alerts that within the healthcare community about incidents that are evolving and the impacts that are being felt. So it's one of our best during incident situational awareness tools. We also have a regional training calendar of trainings and opportunities that are coming up, both sponsored by emergency management, public health, otherwise. That's something that's published monthly and available on our website. Something to put into your training and testing plan as you develop your emergency management plan. We also are really good at developing work groups, and if there is a project that we need to tackle as a coalition, we can develop a work group that's focused on individual provider types, whether it's ambulatory surgery centers, long-term care, whatever that group may need. If there's a project, we can be a convening organization. The other thing I wanted to mention is that we have WATRAC as a patient tracking tool in development right now. Elena led a committee along with several great partners to develop a plan that might be adopted and implemented in our region using that to track patients from the scene of incident to where they need to go and for further elevated care. So as you develop your policies and procedures around staff tracking, patient tracking, and the expectations there, it could be something to look into and start to develop. So there's a lot to be able to fulfill those 4 major buckets. And I didn't go into detail because I'm guessing all of you have been reading them. And if you don't have stacks of CMS-related information on your desk, I have plenty of that to share. Resource guides, summaries, little links to things that might have pictorial diagrams and things that are helpful. But what we thought might be really helpful today for everybody in the room, as well as ourselves, is take the time to share what's everyone doing around this. We have 11 months as a community to bring ourselves up to readiness, and there's several mentions in this emergency management rule that talk about community-based activities, including exercises, including training, including planning. And this is a chance for us to basically come together. So what we'd like to do with our next 10 minutes or so is we're going to break up into 4 groups. Go ahead, Ed. Thanks, Ed. Yeah, our website is srhd.org/HCC, and that's something that is available on our agenda as well on the bottom left corner. If you need to look at it there, it's a quick, easy access. So the plan for us to jump in and share amongst our groups is twofold. One, for those over GoToMeeting, we'd love to hear from you and answer these same questions. That'll probably come in the form of an email or in the form of some functions on the chat box if you'd like to share it out with the group. But in this room, we've got a couple facilitators. I'm going to nominate Janine, even though she doesn't know it yet, Ed, Susan, and myself. And we're going to break up into 4 groups, basically the 4 corners of these tables. And we're going to take 10 minutes and just share what our facilities are doing in our own facilities. out of that, some outcomes we'd like to know are what are identified things that are beyond my easy to access list of ideas? What are things that we as a community would like to see the Healthcare Coalition do? What are things that we can share between our facilities that aren't being shared right now? Is it sharing our templates? Is it sharing plans that are in place? Is it understanding best practices at a regional level by provider type? How can we help facilitate discussion around CMS? From that small group conversation from the facilitators, we'll nominate a spokesperson and share those back out at a larger group level, and then also take the feedback that's shared over GoToMeeting from our remote viewers. So we're going to go from about 10 minutes with a bit of a dead spot for those on GoToMeeting, but then we'll resume amplification after that if you're interested. Any questions about the next 10 minutes or plan or time? Any thoughts on CMS before we break up in smaller groups? All right, to respect everyone's time this afternoon and just make sure we keep moving forward, we're going to go ahead and bring the room back together, and I'm going to hand this mic to Ed to go ahead and start this process off. We're going to go just round table, group by group, and start to share what everyone brought together, ideas about what people are doing, quick summaries, and then summaries about things that might be good projects to collaborate on, and then how we might be able to do that.
Thanks. Well, we had an interesting group. We have home health. I guess you'd be classified as an ambulatory surgery center, and clinics, CHAZ clinics, as well as the Eastern State Hospital. So kind of a mix of different organizations that we have available. Some of the things that we talked about was it would be nice if there is a resource out there that really defines the differences or the similarities between JCO and CMS, so that hospitals that are also JCO compliant can really have a clearer picture of how close are they to meeting those requirements, and are they similar, or what are the differences. So a conversation around that. We had a conversation around exercise component and what exactly that means, and how a facility or how a group of facilities or how a community, what are the requirements and mandates around meeting that obligation. So I think that there will be more conversation around that and better definition. Talked about the need for COOP planning, and sounds like there's some facilities that have gone well far ahead on that, and some that aren't. And the resources on the HCC website are a good place to start around helping them achieve their COOP planning. And then we kind of had a conversation. We had a lot of conversations, but another one around how facilities can, part of the CMS guidelines is really trying to integrate the healthcare system. So really looking at how we can look between facilities to share resources and staffing as an effort. An ambulatory surgery center that is elective surgeries that doesn't have to be functional may have resources that they can partner with the hospital who owns the building that they're in. I don't know if that's true or not, but just an example. So how can they share resources, and how can they make those agreements in advance of some type of situation?
Thank you, Ed. Spokesperson from Janine's group.
Come on. Okay, so we see. This is it's so loud, and I have a big. Anyway, so we have mental behavioral health. We have critical access hospital. We have home health. We have home hospice. And oversee all of them. So we have a surveyor over here. So we discussed using the resources of the HCA that's available, whether it comes through the coalition and what's available online, also the resource through Kaiser Permanente, and the ability to share that, adjust that spreadsheet to your own geographic area and your own vulnerable risks that you have, using that as a team effort within your facility or agency, and not just feeling like you have to meet all these requirements by yourself. I think that's an important thing. We talked about MOUs and being able to have that discussion now and have a better understanding of how you can support each other peer-to-peer like facilities and agencies, and also in smaller counties where we are represented. They kind of already have a set in place community exercise environment because that's what they do now. But their challenge also seems to be that a lot of people do a lot of different jobs, and so they really need to look at their continuity of operations and how that's going to be affected if one person wears 3 different hats, and they're all important hats. Exercises, just again briefly, we want to be able to use the subject matter experts, the hospitals mostly that have been doing this, your local law enforcement, EMS, emergency managers. They've been involved in full-scale to tabletop exercises for many, many years, and they can give valuable guidance and advice and get you included into theirs, which would thus meet the requirement for some of these new CMS rules. Did I forget anything else? Okay. Who can I hand it off?
Thank you, Janine. I think Jeff just raised his hand. Perfect. Jeff's got it. All right. With an unwill, our group had a combination of hospitals, both in North Idaho, as well as Region 9. And then we had ambulatory surgery centers represented. Dick Snell's here from our amateur radio program in our region. And John from Red Cross. We had a diverse group as well as public health perspective. And it was really great to hear that a lot of work's been already underway within the Providence system, as well as Community Health, to make sure that they're meeting these expectations after having done a gap analysis in one case and also having surveyors present in others. So there's a tremendous resource, I think, like Jean mentioned, existing subject matter experts for that. But we also identified there's some real gaps around community exercises as a place to start to develop and improve opportunities. There's good models to follow by using community events to start to develop those community exercises and start to cooperate and collaborate with our EMS, fire, and other partners. But then the group did express some interest in real healthcare-specific exercises that made sure that we were meeting our objective as a group population. Any other thoughts that I missed from our group? Okay. So that's what we had planned for this afternoon with CMS. This has given us some good ideas to move forward with, I believe. And I think the coalition, please use any of our contacts to forward any other ideas that you might have. We want to be responsive to our partners and members' needs. All work through these additional expectations and this expanded group of provider types that are working with emergency management, in some cases for the first time at a level. So please let us know what the needs are, and please let us know how we can help assist and develop regional assets that will be of use. Okay, I'm going to hand the mic over to Ed for our last slide of the afternoon.
Yay! All right, so we have been graced and we have been blessed for somewhat over a year now with somebody that's been working with us very closely that we were able to hire on as a special project position. And that special project position is coming to an end. And I think that we have worked through some great fiscal management skills and other things to extend that out as long as we can. Oh, now I feel like Susan. So Ryan Traylor has been working with us for over a year, and she has been doing a lot of work on our behalf, and she has been keeping many of me, and some of them too, straight and on task in many occasions. And she has really been the facilitator and the driver behind a lot of the work that we have been able to accomplish. And these are just a few examples of what she has done. She has modified, upgraded our Coalition Connection newsletter. It's in an HTML format. God, I even got that right, HTML. She has really been the driver behind WATRAC for the last year and a half, trying to get us set up, trying to get people trained, trying to get people capable of using the system. She was the driver and the developer of our HSORC, our Healthcare System Operational Response process for gathering essential elements of information and sharing that back out with the healthcare system partners. So she has done a lot of work on our behalf, which is really us, because the work got done, which was a really cool thing. And have a small token of our appreciation for Ryan. Ryan, would you like to come up here? It's not much, but thank you very much for all the work that you have done on our behalf to make us that much farther to our ultimate goal. So with that, thank you very much. Would you like the microphone for a speech?
Thank you, everybody. I really enjoyed getting to work with our community. Some of you may know that this has been a totally different career experience for me, and it's been really amazing. So thank you, and I hope to still get to see some of you around.
Well, we truly appreciate all the work that you have done, and this the sad part of the work that we do is a lot of it is grant funding, and sometimes that funding comes to an end, and we have not the resources to continue to fund the positions that we have. Otherwise, this would not be an issue right now. But we are very appreciative of the work that you have done and the successes that you have made on our behalf over the last year and a half, I think it's been. And we wish you nothing but the best. And if you're all wondering, Ryan didn't do that to Elena. So that wraps up our meeting for today. Are there any questions, comments, thoughts? I hope that what we provided today was good information. I know that the feedback we received on the CMS guidance was very beneficial to help us define where we need to go in the future to help you achieve your goals, which ultimately achieves the goals of all of us.
We are in the middle of a norovirus outbreak, as you might know, down at our shelter at the House of Charity. And as we were talking, it occurred to me that if you would like an opportunity to meet your community exercise goal in a staff sharing plan, we are desperate for 4-hour shifts for RN, PAs, ARNP level staff at the House of Charity for probably the next 2 weeks. It's really minimal care, but they do need some medical supervision for the illness portion of it and a respite program that's ongoing there. And we know that this norovirus outbreak will not quickly come to a complete end. Noro never does. But honestly, this could be part of a staff sharing community outreach exercise for your facility for this year if you need that. And we certainly need the help. So if you're interested, please email the Healthcare Coalition email. What is it? Oh, how easy is that? hcc@srhd.org. We could use you or any of your people. Thank you.